Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. I want to welcome you to the Thursday afternoon Joint Task Force update. Today, it'll be me and Dr. Randolph. I'll give a few updates and some key highlights, and Dr. Randolph will give some additional highlights, and then we'll open it up for questions. As of this morning, we have 41,125 cases. That's an increase of 257 over the last 24 hours. But over the last week, we've been averaging about 340 new cases per day, so that's a slight trend upward. While that's consistent with what we're seeing across the state and across the United States, our trend line upward is not as steep as some other communities, and I think that's a testament to all of our early work to contain the virus, but much of the current efforts as well to reduce transmission. And we'll talk more about that shortly. Unfortunately, we have had 604 deaths thus far. As we go into the holiday season, I do think it's important to think about the fact that these are individuals who were here in the early part of the year that won't be here for the holiday season, and the impact that that has on families as they've lost loved ones to the COVID-19 pandemic. One of the other things I wanted to note, in addition to averaging about 340 new cases per day, our case rate per 100,000, which you may see compared to other communities, is 36.3, and that's also trending upward. But what I wanted to spend a few minutes on was the age group that's mostly impacted. So at the current time, we have 9.8% of our cases in young people under the age of 18. We have nearly 14% that are 18 to 24, and then another 20% that are 25 to 34. What's important to note there is 44% of our cases are in individuals less than age 34. And then if we go up to age 44, 61% of our cases are in people younger than age 44. So much of my messaging is, while it's for all people, really pertains to those who are, one, actively infected currently and actively transmitting infection in our community. As of today, we have 3,162 active cases in Shelby County, and we have an additional 7,887 people under quarantine. And what that means is today we have over 11,000 people who are under an official public health order to either remain isolated or quarantined. If we look at hospital capacity, we're continuing to feel some strain in the hospital systems. Majority are in yellow, and in some areas there may be red relative to ICU bed capacity. Also, our testing capacity remains very robust. There is plenty of capacity for testing. We're really urging people to get tested even if they have minor symptoms or they've been exposed to others, or if they feel a need to be tested before travel or after travel. Our public health capacity, while we have added, as everyone knows, over 200 new positions to the health department, and the majority of those are filled. We currently have about 70 vacancies, and those are primarily part-time employees. We are seeing strain in the public health department as well, and that's just because of the number of cases, the demand for technical assistance, and the need for enforcement in addition to contact tracing. But a few key things that continue to come up through the data in Shelby County specifically. While we are all very concerned about asymptomatic spreaders, about 1 in 5 individuals is asymptomatic. Those are people who have no symptoms but still are infectious and pose a risk to others. That means 4 out of 5 people actually have symptoms. Those range from very mild symptoms, could be a fever, a runny nose, allergy-like symptoms, all the way up to muscle aches and pains or GI symptoms such as upset stomach or diarrhea. But of those 4 out of 5 people who are symptomatic, about 53% of people continue to go to work while ill and may work for anywhere from 1 to 3 days prior to feeling sick enough to go for testing. So we want to continue to reinforce the importance of staying home if you do not feel well at all. Very minor symptoms, again, can be COVID, and so we ask that you do not go to work, do not report to work if you have symptoms, get tested, and remain isolated until those test results come back. If they're positive, you have to remain isolated for a minimum of 10 days, and you can assist by identifying your contacts and making sure that they know to stay home and also to get tested. A few other things that I wanted to highlight, and we knew this previously, but I want to reinforce it because there's more research. We know that across the United States, outbreaks are associated with places where people cannot wear their mask regularly, particularly if they're indoors. So things like restaurants, limited service restaurants, or other places that people are indoors and taking their mask off, whether to eat or engage in activity, are really environments where there's high risk for transmission. So I encourage people to really think about going to a restaurant, a limited service restaurant, or a gym, and if they choose to go, making sure that they wear their mask for as much time as they can, really only taking it off while, taking a bite and chewing the food. Also, to make sure that you're trying to go on off hours so that there are less individuals in the space, and that can help us reduce some of the transmission as well. I also want to remind you that if you're going to be around other people who are vulnerable, so people over 55, individuals who have chronic illnesses, it's important that you wear your mask. But we broadly say if you're around anyone outside your household, wear your mask while you're in contact with those individuals. And then lastly, I'm going to reinforce the messages we've continued to reinforce. Masking, we've talked about that at nauseum at this point. Continuing to social distance, that's difficult, particularly as we go into the holidays, but really thinking about that 6-foot distancing, getting tested, as well as getting the flu vaccine.